Hello, everyone. Welcome to my channel. If you're tuning in for the first time, my name is John Jay, and this is Health Talk with John Jay. Now, if you are new and maybe wondering what is my background and how it relates to healthcare, I just want to encourage you to watch my introduction video to get a little bit of insight into my background, my experience, my qualification, and the purpose for this channel. Okay, so for today's topic, I'm going to be discussing, am I afflicted or sick? Am I afflicted or sick? And is every disease caused by witchcraft or bewitchment or the devil or the enemy? So, by way of introduction, I'm pretty sure you can all agree with me that there's this widespread belief among so many cultures that most diseases or every disease is caused by witchcraft or bewitchment or the devil or the enemy. So don't get me wrong, I'm not disputing this fact either. I'm not saying that it is false or it does not exist. The issue is that because of this belief, a lot of innocent lives are being lost prematurely because people think that this is caused by witchcraft or the devil, and they delay in seeking medical care, they delay in seeking medical advice and treatment, and their lives are being lost prematurely. And this is why this topic is very important today. So for the objectives for today, I'm going to be discussing what is an affliction, what is a disease or a sickness, and how are these two different from each other. So when we look at affliction, according to the Webster Dictionary, an affliction is a cause of persistent pain and distress, great suffering, or mental distress. It's a cause of persistent pain and distress, or great suffering or mental distress, according to the Webster Dictionary. So when we look at that, some examples for an affliction could be, learning to live after losing your sight to an ailment, be it diabetes or an injury or an accident or any form of misfortune or trouble, or for instance, the current pandemic, have caused a lot of affliction globally and on families and individuals, because a lot of people lost their job, their livelihood, and it caused a lot of financial constraint. And then because of the social distancing, people are not able to connect or have that close contact with their family, friends, and loved ones. So those are some examples of an affliction. So it can be your circumstances that can cause this great suffering or pain on an individual. So when we think of affliction, that's what this term means, and those are just a few examples of affliction. So moving on to a disease. What is a disease or what is a sickness? We often hear this term, oh, this person is sick or this person has a disease. So again, the Webster Dictionary defines a disease or sickness as a condition that impairs normal functioning. And this is often manifested by distinguishing signs and symptoms. So someone may ask, what is signs and symptoms? So signs and symptoms could be anything from nausea, vomiting, headache, chest pain, shortness of breath, or where you have swelling in your ankles, your feet, your hands, your face. It can be stomach pain, it can be diarrhea. Those are just some examples of signs and symptoms, or it can be chest pain. Okay, so when we look at examples of diseases, I'm sure we can all, you know, relate to that. Some examples are heart disease, cancer, hypertension or high blood pressure, hypotension or low blood pressure, kidney disease, liver disease, diabetes, hepatitis. Those are all some examples of disease, and there are many others. Now, how are these two different from each other? How is an affliction different from a disease or sickness? So again, from the definition, we see that an affliction is a cause. So a cause from something that is outside of the body. And a disease is a condition from inside of the body. So affliction, something outside of the body causes you to be afflicted. Okay, so it can be, like I said earlier, it can be circumstances, it can be situation that cause you great suffering and pain. And then disease is a condition from within the body. So somewhere inside your body, something is not functioning the way it should be functioning, and this is manifested by those signs and symptoms where you will be nauseous, you will be vomiting, and so forth. So something from within the body causes this condition that is referred to as a disease. So affliction is something from outside of the body, and disease is something from inside of the body. So that's just a brief, difference between the two. So just to summarize our topic today, for those of us that are of the Christian faith, there is this story in the Bible, in the book of Luke chapter 17 from verse 11 to 19. And this story tells us about 10 men that had leprosy. So the story further tells us that these men were standing afar off, and they saw Jesus was passing through. So they shouted, "Jesus, Master, have mercy on us." And Jesus heard them and told them, "Go and show yourself to the priest." And the Bible further tells us that as they were going to show themselves to the priest, they looked down and realized that they were clean somehow of this disease. So for those of us that are unfamiliar with what leprosy, another name for it is called Hansen disease. It's a bacterial infection that can be very contagious if it's not diagnosed and treated early. It affects your skin, it affects your eyes, it affects the lining of your nose, meaning inside of your nose, and it affects your nerve, according to the Center of Disease Control and Infection. So if this disease is left untreated, if it's not diagnosed and treatment started early, it can cause crippling of your hands and feet, it can cause paralysis, and it can lead to blindness. So if you are wondering, how is this story related to this topic? So there's three interesting points to this story. So the first one is that the men stood afar off. So the point is that they realized that this disease is very contagious. It's a very contagious disease. So they were taking the necessary precaution by standing far off so as not to get other people afflicted with this leprosy. Which is the same thing that we are being encouraged to do in this pandemic with COVID-19, to maintain our social distancing, wearing masks, hand washing, and making sure that we are wearing our masks when we're going out, so to avoid either getting someone else's sick or getting sick as well from someone else that already has this disease. And then the second point of this story is Jesus told them to go to the priest, go and show yourself to the priest. So back in the day, or the culture for that time, the priests were also doctors. So by Jesus telling them to go and show yourself to the priest, it tells us that God approves of us going to the doctor. So whether you think you have an affliction or you have a disease, it's okay to seek a professional medical advice. It's okay to go and seek medical advice for diagnosis and to start treatment. It is okay by God. He's approved of us going to seek care, whether to confirm that you have a disease or whether to confirm that you've been healed of a disease if you are afflicted or if you have some type of condition. So it's okay to seek medical care for those of us that are skeptical and maybe thinking that, oh, this is caused by witchcraft or the devil, so I don't need to go to the doctor. It's okay. Either way, it's fine to seek medical advice. It's okay to seek medical diagnosis, and it's okay to get started with treatment. And the third point to this story is that the Bible said, as they went, they were cleansed as they went, as they were going. So what is in this point? So it means that every treatment or deliverance involves a process. And if you are sick or if you have a condition, the process of getting the process that is involved with a disease is by going for your doctor's appointment, seeking treatment from your medical practitioner or your medical provider, sticking with your treatment plan, following your doctor recommendation, going for your blood work or whatever testing the doctor decides to send you for. So everything, whether it's an affliction or a disease, there's a process that's involved with getting your healing or getting your deliverance. So in final conclusion, every sickness is not caused by witchcraft, the devil, or your enemy. Seek timely professional medical advice is critical to your overall health. So if you are sick and you go to your doctor and your doctor assesses you and send you for testing, whether it be blood work or diagnostic testing like X-ray, MRI, CAT scan, or ultrasound, and based on those test results, your doctor informs you that you have a medical condition, be it cancer, kidney failure, high blood pressure, diabetes, hepatitis. Please do not start rebuking the devil or rebuking your doctor or saying, doctor, listen to your doctor. If you want to get a second opinion from another doctor from a different practice, that is fine depending on the situation and circumstances. But please follow your doctor recommendation for treatment. Early detection, diagnosis, and treatment is critical for your overall health, your well-being, your quality of life, and your survival. Delaying your treatment can potentially lead to really bad circumstances, and worst case, it can be fatal. So let us seek medical treatment and recommendation to avoid from losing our life prematurely from something that could have been easily treated or prevented. So go home, evaluate your lifestyle, what you are doing that you shouldn't be doing, like drinking or smoking, what you should be doing that you are not doing, evaluate your eating habit and make the necessary adjustment. Pray over your doctor's recommendations and ask God to lead you and to protect you from harmful treatment side effects. So we have come to the end of this discussion. I hope this was helpful, and if you like what you heard, I want to invite you to tune into my next video. Please feel free to comment on what helped you and what didn't. Again, thank you for tuning in, listening, and staying with me to the end. If you have not yet subscribed, I just want to encourage you to subscribe and like, and most importantly, share this video with your friends, family, and loved ones. Again, thank you so much. My name is John Jay, and this is Health Talk with John Jay. Bye, and have a blessed day.